Hello, my name is Jeff Petersen. I want to talk to you today and in the next in this series about joint protection. So years ago when I first became a therapist, about 40 years ago, I worked with a guy named Arnold Buntrock. He was a great athletic trainer and a good man. I learned a lot from him. And one of the things he taught me is the way you keep from getting stiff in the joints at night is don't go into them. He said it was the only way that worked for him. So with that in mind, we're going to proceed, talk about the general principles of joint protection. I'm not going to go into pathological injuries for athletics, just general principles that you can use at home, particularly if you have some pain or some irritation, to protect your joints. So if this is helpful, please like, subscribe, share it with your friends, and follow us on Facebook. So let's start with the general principles of joints and forces, because that's what we're talking about. Our bodies respond to the forces that are applied to us. Exercise is nothing but controlled stress to your body to help it get strong. When those forces exceed the tissue's ability to withstand it, then you have injury and dysfunction. So there are some general forces that are applied to joints and to tissue in the body. The two broad categories, again, this is excluding pathological conditions, because there are several conditions that it can affect the joints. But the two broad categories of forces are compressive forces. So if I have something here, tissue, and I put compressive force on it, that force from the external environment is going to have an effect on that tissue or whatever we're applying that force to. The other force is a tension force or tensile forces, and we see this in tendons and ligaments. So tendons and ligaments have the ability to stretch a certain amount, but as you apply that tension force, it is going to impact the tissue. Now, a certain amount of force is necessary for growth and normal health of a joint. Again, too much force is not going to be helpful. The other thing is there are different types of joints, but let me just show you. All of our joints are really very inefficient levers. And if you remember your physics and the old seesaw, you got a weight here. I'm going to use a different marker. You have a weight here, you have a weight here, and you have a fulcrum right in the middle. If these weights are equal, then you have that seesaw will stay level. If you have a greater weight here, then this seesaw is going to drop. Or, more specifically, if you have a weight here and a weight here, and we lengthen what's called the lever arm, then there's going to be, with equal amounts of weight, there's going to be greater resistance with the longer lever arm. So the example is, if you look at your biceps, if you wanted an efficient lever arm, your bicep would attach down by the wrist. But then it would be in the way, you couldn't move. So even though it's an inefficient lever, it's a unique design, so that the biceps attaches to the radius closer towards the elbow, like here, which means it needs to do more work to be able to move the hand. The other thing that's impactful for joints is there are different types of joints. So I'm going to grab a couple models. So, if we look at the hip joint, you can see the hip joint is the classic ball and socket joint. The ball is firmly seated in that socket. Now within that, on the outside of that ball is articular cartilage. That helps absorb some of the compressive forces. It also helps with that joint gliding on the inside of that acetabulum or that socket. And in the inside of the socket, it's also coated with a smooth surface that allows for gliding. That's articular cartilage, and it's, there's a certain amount of thickness to it. And some of you may have been told you have bone on bone. That's when that cartilage wears out completely. So you've got the ball and socket joint. When you've got the knee, it's kind of a modified ball and socket. You see the concave surface here, and you see a very shallow socket here. This is sometimes called a hinge joint. So you've got the articular cartilage on the end of the femur, you've got the articular cartilage on the inside of the tibia, and it sits here. But you can see this one is much less stable than the hip joint because the ball is firmly seated in the socket. And then you've got other joints. You've got planar joints that are more shaped like they're more like a flat plane, and you'll see those in the low back. In each of the spines, you'll see the front is the vertebral body. The back is these projections of bone that serve as attachments for ligaments and muscles. Each of us can feel usually the spine on our backs. And then you've got these projections where it serves as a bone to articulate with another bone, which is what a joint is, where one bone meets another bone and there is movement. The ligaments will attach bone to bone. Each joint, or most joints, are surrounded by a joint capsule that provides the lubricating fluid. And then the tendons attach to the joint at some place to move the joint. So those are the tissues that are involved in protecting joints. You want to protect your articular cartilage. You want to protect the ligamentous structures. You want to protect the joint capsule, and you want to protect the tendinous structures and the muscles that move those joints. And each of those have some unique properties. Some joints experience more compressive forces, some joints experience more shearing or tensile forces, and some just get stretched. And you see that with knee injuries. The other thing that's really important to note is that when it comes to joint mobility, there is a continuum. And when I was in school, we studied that continuum and we graded it. And the grade is from 0 to 3. I mean, it's from 0 to 6. 3 is right in the middle. 0 is here, and 6 is here. So a joint that is at a 6 level of mobility, and when I say mobility, it's not the normal mobility. So in the hip, there's normal range of motion when the hip glides properly. But there's also a certain amount of joint play. These joints don't sit perfectly and they're really tight. There needs to be enough joint play to allow for normal movement. If that is at 0, then that joint is fused. Sometimes fusion is a treatment of choice for a joint that's pathologically unstable, which would be a 6. This is a joint that you've ruptured the ACL, you've had a dislocated hip, it's moving too much, your shoulder dislocates. There's just too much movement there for it to work in a nice, stable position. 3 is perfect. We see people that typically come in that are at 3.5, 4, that have some hypermobility, and it creates all sorts of challenges. One of those is, some of you may have heard of bone spurs or osteophytes. Well, what an osteophyte is, and we can show you here on the back, what an osteophyte is this little joint here in the lumbar spine has 3 to 5 degrees of motion. If there's too much motion here, what happens is where the joint capsule and the ligaments attach start to pull on that bone. That bone creates extra growth, that creates an osteophyte or a bone spur. That's your body's attempt to stabilize that joint. By the time people come to see us and they have bone spurs in their back or in their shoulder or in the neck, that joint has been hypermobile for a long time and is now compensated, formed extra bone to try to stabilize that joint. So we're going to talk about what to do before that so that you don't develop those hypermobilities, the bone spurs, the pain, the irritation. And there are key areas in each joint that are really important, and in future episodes we're going to go over exactly what you can do for those specific joints. So I hope you continue to follow. Thank you.